Question 111. Radiation therapy is used to treat colon cancer before surgery for which of the following reasons? A. Reducing the size of the tumor. B. Eliminating the malignant cells. C. Curing the cancer. D. Helping the bowel heal after surgery. Question 111. Answer: A. Reducing the size of the tumor. Question 111. Explanation: Radiation therapy is used to treat colon cancer before surgery to reduce the size of the tumor, making it easier to be resected. Radiation therapy isn't curative, can't eliminate the malignant cells, though it helps define tumor margins, could slow post-operative healing. Question 112. Which of the following symptoms is a client with colon cancer most likely to exhibit? A. A change in appetite. B. A change in bowel habit. C. An increase in body weight. D. An increase in body temperature. Question 112. Answer: B. A change in bowel habit. Question 112. Explanation: The most common complaint of the client with colon cancer is a change in bowel habits. The client may have anorexia, secondary abdominal distension, or weight loss. Fever isn't associated with colon cancer. Question 113. A client has just had surgery for colon cancer. Which of the following disorders might the client develop? A. Peritonitis. B. Diverticulosis. C. Partial bowel obstruction. D. Complete bowel obstruction. Question 113. Answer: A peritonitis. Question 113. Explanation: Bowel spillage could occur during surgery, resulting in peritonitis. Complete or partial bowel obstruction may occur before bowel resection. Diverticulosis doesn't result from surgery or colon cancer. Question 114. A client with gastric cancer may exhibit which of the following symptoms? A. Abdominal cramping. B. Constant hunger. C. Feeling of fullness. D. Weight gain. Question 114. Answer: C. Feeling of fullness. Question 114. Explanation: The client with gastric cancer may report a feeling of fullness in the stomach, but not enough to cause him to seek medical attention. Abdominal cramping isn't associated with gastric cancer. Anorexia and weight loss, not increased hunger or weight gain, are common symptoms of gastric cancer. Question 115. Which of the following diagnostic tests may be performed to determine if a client has gastric cancer? A. Barium enema. B. Colonoscopy. C. Gastroscopy. D. Serum chemistry levels. Question 115. Answer: C. Gastroscopy. Question 115. Explanation: A gastroscopy will allow direct visualization of the tumor. A colonoscopy or a barium enema would help diagnose colon cancer. Serum chemistry levels don't contribute data useful to the assessment of gastric cancer. Question 116. A client with gastric cancer can expect to have surgery for resection. Which of the following should be the nursing management priority for the preoperative client with gastric cancer? A. Discharge planning. B. Correction of nutritional deficits. C. Prevention of DVT. D. Instruction regarding radiation treatment. Question 116. Answer: B. Correction of nutritional deficits. Question 116. Explanation: Clients with gastric cancer commonly have nutritional deficits and may be cachectic. Discharge planning before surgery is important, but correcting the nutrition deficit is a higher priority. At present, radiation therapy hasn't been proven effective for gastric cancer, and teaching about it preoperatively wouldn't be appropriate. Prevention of DVT also isn't a high priority to surgery, though it assumes greater importance after surgery. Question 117. Care for the postoperative client after gastric resection should focus on which of the following problems? A. Body image. B. Nutritional needs. C. Skin care. D. Spiritual needs. Question 117. Answer: B. Nutritional needs. Question 117. Explanation: After gastric resection, a client may require total parenteral nutrition or jejunostomy tube feedings to maintain adequate nutritional status. Question 118. Which of the following complications of gastric resection should the nurse teach the client to watch for? A. Constipation. B. Dumping syndrome. C. Gastric spasm. D. Intestinal spasms. Question 118 Answer. B. Dumping syndrome. Question 118 Explanation. Dumping syndrome is a problem that occurs postprandially after gastric resection because ingested food rapidly enters the jejunum without proper mixing and without a normal duodenal digestive processing. Diarrhea, not constipation, may also be a symptom. Gastric or intestinal spasms don't occur, but antispasmodics may be given to slow gastric emptying. Question 119. A client with rectal cancer may exhibit which of the following symptoms? A. Abdominal fullness. B. Gastric fullness. C. Rectal bleeding. D. Right upper quadrant pain. Question 119 Answer. C. Rectal bleeding. Question 119 Explanation. Rectal bleeding is a common symptom of rectal cancer. Rectal cancer may be missed because other conditions such as hemorrhoids can cause rectal bleeding. Abdominal fullness may occur with colon cancer, gastric fullness may occur with gastric cancer, and right upper quadrant pain may occur with liver cancer. Question 120. A client with which of the following conditions may be likely to develop rectal cancer? A. Adenomatous polyps. B. Diverticulitis. C. Hemorrhoids. D. Peptic ulcer disease. Question 120 Answer. Adenomatous polyps. Question 120 Explanation. A client with adenomatous polyps has a higher risk for developing rectal cancer than others do. Clients with diverticulitis are more likely to develop colon cancer. Hemorrhoids don't increase the chance of any type of cancer. Clients with peptic ulcer disease have a higher incidence of gastric cancer.